The issue about family planning and how it affects the country has been one issue we all know about. The statistics are there. And somehow it's almost certain we have an idea, or perhaps we know what to do. I think the issue has been, do we as a people, as a government, as players in different sectors, have the willpower to address them? His Eminence, Pastor Ayo Rijafo, made this quote once in a Newry function. He said, "The Christian man is the leader and provider of the home, and the woman the nurturer of the family. Children are a supreme gift from God, and like every gift, they should be cherished, nourished, and loved, for their upbringing should be well thought out and planned for." His Eminence the Sultan also said, "It is therefore unpardonable for us to ignore our women and children, exposing them to obvious ill health and mortality in circumstances related to complication in pregnancy or childbirth at this age of scientific and technological advancement." I want to say that we have not been strategic enough in targeting men as change agents in most of our family planning programming. Neither have we gathered enough body of evidence or research to show men's participation in reproductive health and family planning. We must begin to think of how we can create a cohort of trained men community mobilizers, knowledgeable family planning champions, and national spokespeople for family planning in Nigeria. The family planning champions and spokespersons should be men with moral and religious authority across the country, whose voice and opinion are respected and whose call to action on family planning is heeded. When a man does not speak up in favor of family planning, there is an assumption that they are hostile to the subject. But a positive attitude towards family planning on the part of men enhances and facilitates the use of effective contraceptive method. The FP champion and spokesperson must help to raise and amplify both the health and the economic arguments in favor of family planning as a means to manage Nigeria's expanding national population. A deliberate national effort should be made to increase men's interest, involvement, and participation in reproductive health, including family planning. Family planning programs should begin to position FP as a means to achieve gender balance in men's and women's reproductive rights and responsibility. The statistics are staggering, but if we begin to see family planning, or child spacing, as we prefer to call it in some climates, as a resource planning tool, we will realize that it is one of the most cost-effective ways of preventing maternal, infant, and child mortality and morbidity. It can be used to reduce maternal mortality in risky unintended pregnancy. It will help reduce the number of abortions we see and the proportion of high-risk birth. It has been estimated that meeting women's need of modern contraceptive will prevent about 1/3 of all maternal death. Usafa has mentioned the statistics. I won't bore you with, and I think some of us is engraved in our mind. But we need to know that, and agree here, that men involvement in family planning is very, very important. Why is that? Men are, in developing countries like Nigeria, tend to dominate discussions and decisions around reproduction, family size, and contraceptive use. Men are also recognized to be responsible for the proportion of ill reproductive health suffered by their female partners. Spousal communication on contraception and reproductive goals is important in modern contraceptive use and continuation. Couples that talk about it and make a decision to their health and use of contraceptives most likely will continue using it than when they do not discuss. It's not said to be very necessary, but it's very important. Although contraceptive methods and services are geared towards women, men are often the primary decision makers in family planning, family size, and the method their wives or their partner use. Family planning and reproductive health services are still traditionally provided within the context of maternal and child health. Ironically, enforcing the belief that family planning is largely a woman's business, with the men playing a peripheral role. Now, I could go on with this, but I want to say that in our own estimation, and our thinking, and in our experience as married Stopes, we think one of the best ways to start looking at how we can innovatively trying to address this elephant in the room, which we're talking about male involvement, is so we have to start thinking about how we can extend family planning programming and partnerships to men professional groups. We believe it is important to extend this partnership to men involvement in family planning and reproductive health to professional groups and organizational associations that are composed mainly of men. We have to do a bit of remodeling of our conventional family planning clinics. To be honest, it's almost assumed that if it's family planning, men shouldn't bother coming. Even when we tend to target family planning in service delivery, we tend to go when it's maternal, when it's immunization, or when, in some cases, when the men feel it's not their business to be there. But I think we need to make conscious effort. How do we attract men to the centers with their wife when the time comes? And I think lastly, we'll say engaging men in family planning mobilization in the community and ensuring that they serve as advocates has the potential to increase acceptance and use of family planning services. We have done a lot of this. We've used this in very critical regions like Gombe, where we had gotten Muslim male as community mobilizers in Gombe, train them if rightly in what to say, understanding of what the Quran says about family planning, understanding of what the men's cultural beliefs are, and having that discussion with them at their comfort points, easily having them engage. And from our own experience, we did that in Katsina, and we saw contraceptive uptake increase. And I think if men talk to men, we know men are largely going to believe men more, and especially when the man is who they know and who they are comfortable with, and they feel that the men understand their own perspective first, you're going to see them respond better. I think this is one strategy which we can start immediately, but failing to have this level of conversations with men, continuously treating men as if, you know what, you're not the person taking up the service, so don't be involved, or maybe in some cases thinking if we only insist on the women, they will take the service and that will ensure that they continue to use the service. That might not be the same, and in some cases, it's not a very sustainable practice. I would like to stop here. We could talk for long about this, but I'm sure there will be other opportunity. Thank you for the opportunity. As a method, as one of the resource tools for managing our population explosion. We've heard today that Nigeria, as it is right now, we have 198 million Nigerians. And by 2050, there will be 450 million of us. Now, when we consider our land mass, which is about the size of Texas, we need to ask ourselves, can we not begin to think clearly around our choices? And can we begin to think, what are the factors that we can use to increase uptake of family planning in the country? So this forum is talking about men as change agents. We know that men are key decision makers in the family around number of children, key decision makers around their wife's health, key decision makers around resources they even can get into the family, to make sure the family is healthy. Now, if we recognize this role men play, then we need to ask ourselves, how can they become the change agents we need to push our contraceptive prevalence rate a bit forward? And we know that they have significant roles to play from what we've heard today. Yes, I think we first understand some of the things men respond to. We agreed here that men respond to authority. So in terms of communicating this family planning thinking, the government has a crucial role to play. If the government says, we think you should have 10 kids, we're going to have men that will believe that. And as long as there's incentive to allow that to happen, it might continue to be the case. But we also know that men respond to other men, their peers. And we feel that if we get more men, one, as family planning champions, men of moral strength, credibility, to come and talk to other men, you're going to get better response. If we get community health workers that are men, that understand the various cultural, socio-cultural situations that men consider as important and meet them and discuss with them. If we involve professional bodies, men professional bodies, to understand first and also ensure that they talk about it, you will see a change. You have to understand that if you sit in a garden of men and you're the only one looking as if you have no self-control, you don't care about your wife, or your daughter, as the case may be, men won't feel very comfortable in that kind of gathering. So how do we ensure this level of integration from FP champions to community health workers that are men, to gatekeepers, religious leaders that can stand up and tell the men, this is the right way to go. This is showing love to your family. This is what you do if you consider your country. And if you appeal to the patriotic views of men, you also know you get the same reaction from them too. Well, largely we're not funding enough when you consider the population we have to reach. Now, has there been an improvement? Over the last 5 years, significant improvement. In terms of policies, like I talked about the tax shifting policy, in terms of even the money governments put forward as their own counterpart funding for the products, commodities, family planning commodities that is distributed free across the country. There are different coordination is better around partners and donors to ensure we get better results with this money. But it's still, in our own sense, a drop in the ocean. And like the UNFPA rep said, Ghana, yes, population-wise, we are less than India, but India is putting close to $1 billion, into family planning. It's something we could do better, and I think we should ask our government to do better, because at the end of the day, we worry that at the time, if we start late, it might be more. We might have to take more drastic steps, like China had to take, like India had to take, sterilization, one family, one male child per family, which is not where we need to go to as a nation.